Yo, what's up, everybody? Okay. Man, we got like 20 people in here. Wow, we got 19 people in here and 20 likes. Wow, we're already starting off on a good note. I hope everybody's having a good day, slash week, slash life. And so, uh, I don't even know why I say it at this point, but guys, this is going to be a short live. But honestly, I'm hoping I can be done in 30 minutes. And so I'm going to try to do more of a rapid fire QA. By the way, guys, no affiliate codes, no promo codes, no nothing. Okay. Um, Time's a little hard for your boy right now. Okay. But this is an old Navy. Like it's called. They call it like tech, not tech fleece, but it's like Anyways, right now, like the tops are $20 and the bottoms are $20 on Old Navy. So like if you want a solid looking like tech fleece, but you don't want to pay Nike money, it is a really good option. And I think it's like 50% off for like the next, I don't know, 12 hours or something. Use code HINK on Old Navy. No, but for real, yeah. So anyways, if you're interested, check it out. I wanted to buy some Nike gear, but I went online and it was like $80 for a hoodie, like $100, and it was like, and I'm just not paying that shit. So, anyways, what's up, everybody? So, let's start going into um the questions. So, Super Mario says, I'm on my second year of PE, didn't gain much of anything because I went too hard too quickly. The question now is starting my second year, and I began slowly starting at 2.8 pounds and 6 inches of mercury. Um, I don't know what that's a question, man. So sorry. Um, So KB says, "Do you think 150 of the Icarin is too much?" And so Icarin is the extract from horny goat weed that is actually like the potent component of it. And no, I don't think that that's too much. As long as you can tolerate it well. There's weird conflicting evidence that basically show not I won't say conflicting evidence. It just shows that at too high a doses, it can actually decrease test levels. And so I just something to be aware of, that you don't want to just like absolutely slam like horny goat weed or the Icarin component from it. Um, oh my God, Jadink is in the house. NMC Nutrition Doc is in here. Red Maroon is in here. KM says, good to catch a live on time for a change. Oh, awesome, man. Well, it's funny. I see some of the comments. It's like, finally caught a live, Nathan Miller. And it's like, I don't know. I feel like I go live kind of regularly, but it's honestly dope that people are excited to catch me on a live stream like that. That's wild. I wouldn't have imagined that for myself. So anyways, so Michelangelo says, "What's up, Pink? Hope your day's going well. Appreciate all that you do for us, bro. I really appreciate that, man. I really, I really appreciate the kind words. You guys know that. Um, so my guy Gurkulations says, "Hey, Hink, any advice for me? I've had bad EQ for months, and I've tried exercise and diet, and most recently drinking grape juice. I don't own a pump either. Um, Man, that's hard. Like, no pun intended, but, like, do you smoke? How old are you obese? And you said that you've tried exercises and diet, like, are you obese and you just started trying exercise and diet, but you haven't lost weight? Like, how consistent with you have you been? Drinking grape juice, there is some actual evidence that, like, grape extract can actually help improve erection quality, but drinking grape juice like a sugary essentially a sugary drink, that's not I mean, I don't know who told you that was gonna help with anything, but I don't believe that's gonna help. This light is too bright. If you haven't seen my video on, like, do these things to avoid, I don't know, avoid these things for bad erection quality, I forgot exactly what it was. My phone randomly starts playing the live streams as they're here. But anyways, so yeah. Um Damn, Red Moon says I'm still sick. I hate that, bro. Oof. So saucer. So uh thank you for the super chat. But he says, Hink, this might seem like a dumb question, but how would you know if you're still in puberty and still have potential gains in the tank? I'm 18. Um, it really depends. I mean, part of it is you can kind of extrapolate from your parents. If you know that like your dad went through puberty at like 16 and had a beard and facial hair by the time he was 18, then you're probably done. I mean, everybody is different, but like typically if you look at the different I mean, like, if you wanna be super scientific about it, go online and look up what are called the Tanner stages, and so it's the Tanner stages of maturation, Tanner. Um, and it's basically, like, how you can gauge your puberty. Typically speaking, like, if you're starting to get hairy, especially things like facial hair, body hair, I mean, or you should know pretty much your growth trajectory. Like if you have stopped growing, you're pretty much done with puberty, like for the most part. Uh, I mean, and have you noticed that your like D is continuing to grow? I mean, for some people, like they have I guess later stage puberty, like your boy here, I was still growing, geez, even my D was still grew like into my senior year of college actually. And so the question would be, uh well, no, that's not the question. I don't want to talk about like how early should you start doing PE? There's a guy, and I really appreciate this guy commenting on my videos, but he says like basically like Hink, I'm 18. Like, should I do PE? And I'm just like, I'm not gonna tell somebody 18 to like to or to not do. I would probably advise you not to do it because it's potentially risky. Typically, when you're 18, you're dumb and you don't know what you're doing and you're impatient and you just want like especially this day and age, you just want instant gratification. And so you might do like the first thing that you see, which could potentially be dangerous. And so I would in general, I would say don't do it if you're 18. But, like, I don't know, if you have especially if you have, like, significant facial hair, you're not growing, you probably don't have much gains in the tank, and you probably, like, for the most part, completed puberty. I personally don't know one definitive way to know that once and for all for good. Um, so, um, Andre, what's up, man? It's been a while. Love that name. I say that every time I see a live stream. I mean, your name on the live streams. But he says, "But thank you very much." He says, It's been a while since I got the chance to tune into a live stream, but I took your advice and instead of focusing on PE, I lost north of 40 pounds, and I have seen a lot of improvements. Keep it up, doc." Bro, like salutes to you, my friend. I mean, you had the you were kind enough to send me a super chat. Like I should be sending you a super chat for posts like that. And guys, like I truly can I pin a super chat? I don't think I can pin a super chat. That's annoying. Um, but man, like you should love your body, guys. I would never want somebody to like watch my video and then feel bad about themselves if they're overweight or something like that. But man, if you guys would just like if you're overweight, certainly if you're obese or super obese, if you lost weight, like I can't tell you how much better for almost everybody. I can't say I guaranteed everybody would just feel you gonna be like, you're gonna have less body fat, so your D is gonna proportionally look bigger. You're gonna have less, suprapubic fat, and so you're actually gonna have more D, like, visibly exposed. In theory, you're gonna have better, like, circulation, so you're gonna have better erection quality. And then also, like, you just, typically speaking, are gonna like the way you look better. It's now, guys, like, please understand, I'm not trying to make anybody feel bad, but it's like, this whole fat acceptance movement, whatever. If you're pro that, that's fine, but it's just kind of interesting that then all of a sudden, like, Ozempic came along and nobody wants to be fat anymore when there's, like, a magic pill to lose weight. And so it's just interesting, those same, like, fat influencers, and I don't mean that in a pejorative way, that's, like, kinda self-described, like, pro-fat, like, now wanna lose weight. And then, like, they lose weight and they're like, "Wow, I feel better, I look big." Like Lizzo. I mean, I don't know, guys. Obviously, I feel passionate about fitness and weight loss, so good for you. I would love to know, specifically what your, like and I'm sure the other guys would wanna know, like, how it's affected your D, especially, like, your size, your perception of it, man, maybe even like, how your partner reacts to it. Um, so Caleb says, "Hink, I know you give, a lot of crap about Drake, but trust me, Kendrick is just as corny and a hypocrite." I love Drake. Um, and, we're not gonna go into that because I know you guys don't care, but, But I also love Kendrick. Like, Mad Good Kid, Mad City is one of my favorite albums all time. Hink, shut up and dribble and talk about PE. Okay, guys. Okay, I'm sorry I diverted to hip hop for 30 seconds. Um, all right. So, got that. Oh, no, I missed one. KB Reef, thank you for the super chat, bro. He says, "Thank you for all you do, hunk McSexy berries." I'm down with it, bro. I hope things are going well, brother. Thank you, bro. Thank you very much. That's a new one. I still prefer the JLCK. If you know, you know. If you guys know in the chat what JLCK is, like type it in because that would make me happy to know that lore still exists. Because I still remember that, and that's still my favorite one thus far. But and it's funny that like I know it's like hink hunk, it's like the typo autocorrect thing, but like some people genuinely think that I'm like have made comments about me being good looking, and it's like I'm wearing a full mask. Like all you can see is basically my teeth. But thank you anybody, anyways, for anybody who thinks that I'm not a bad looking dude. I appreciate that. And thank you for the super chat very much, KB Reef. Um, let's see. But and once again, huge shout out to my guy Andre, man. More power to you guys. I hope you other guys that are interested in losing weight can see that and be motivated by it. 40 pounds is a tremendous amount of weight, like a life changing amount of weight, guys. So Jason, thank you for the super chat, bro. He says, "What do you think of Caleb's pump routine? It's greatest at reducing petechia, but how great for gains?" Um, Caleb's in here. Caleb's my boy, and but I'm gonna be open and honest. Like, I think his routine is good. Um, Personally speaking, like, does it reduce petechia? Yeah, it reduces petechia because kind of like half the time you're pumping at a lower pressure that's not more prone to petechia. So, like, yeah, of course, it's gonna reduce petechia. Um, for gains, I mean, he's gained tremendously with it. I have gone kind of back and forth, and sometimes I'll make a video and I'm like, like, you should be pumping to 11.8 inches of mercury. Listen to me, I'm Hank, derp a derp. And then other times I'm like, guys, I only pump to 8 inches of mercury. And so I think you can absolutely still make gains with lower pressure. And I think he has something that works for him, and it's kinda like diet, man. It's like people are like, "Oh, what's the best diet? Hink, should I go keto?" And it's like the best diet is what works for you. The best PE routine is what works best for you and what you see results. So, um, I think I mean, I like for me, I like ease and simplicity, and so, like, I like kind of a set it and forget it, and that's part of the reason why I like the auto pump so much. But, like, the thought of, like, having to consistently pump through every set, I don't like that. But, like, if it works for Caleb, then that what works for him, and if you try it and it works for you, I think that what work that's good. But I think, ultimately for my goals, which are, once again, simplistic, is I try to get, like, my set amount of time at the set amount of pressure that I'm desired. And so the easiest way for me to do that is to do a warm-up set and then do, like, working sets at the pressure I want. So I know, okay, I did 4 sets of 5 minutes at 8 inches of mercury, instead of being like, well, I did 4 sets of 5 minutes, but each minute I progressed, and so I only did, 5 minutes at 5 inches, 5 minutes at 6 inches, 5 minutes at 7, etcetera. So it's just whatever works for you. But I love the fact that dude came onto the channel and showed his routine and and you guys seem to genuinely like that, and it actually gave me good ideas to have more people on there like that. So I don't know. If you guys aren't on my subreddit r/hink, you might wanna join because I'm probably maybe gonna start being more active on that, especially, like, answering some questions on there. But I'm gonna start bringing back the, like, routine review. I'm gonna bring that back, on r/hink, and I also, am probably gonna open it up for guys to come on the channel like Caleb did. You don't have to be like, "Hi, my name is Michael Smith, social security number 555, my date of birth is blah, blah, blah." Like, you could come on the channel and, like, wear a mask, like, if you want to, or wear a hoodie and a hat. Like, you don't have to give your identity, but I do think it's helpful for guys to share their experiences, and so I'd like to do that. So let me know if you guys are interested in that. Uh Nothing says ink is a dime. Oh, man. I don't know why I don't know why that's so funny to me, man. Oh my gosh. Hold on, I see it. So Robert says, JLCK, what percentage of people from the 7 who completed your trial did once versus twice a day? Um, I would say probably 20% of the guys did a twice a day, approach. Um, Mario says, "Yo, Hink, can you answer my question?" Mario. Yo, Red and Caleb, that's from Mario. Mario, do you think the Shield nerve support supplement can help speed up recovery from a minor penile nerve injury? The ingredients that are in that supplement have been clinically proven to help with nerve health, nerve recovery, and nerve regeneration. Okay. I cannot go on the record and say, if you take Shield, it is going to speed up your recovery. Okay. But there's what I would urge you to do is to look at the Shield supplement. Okay. Turn it around, look at the ingredients on the back, and, for time's sake purposes, say, "Chat GPT, tell me about the nerve function, or, like, nerve recovery function or nerve benefits from these ingredients," and just see what Chat GPT says, and I bet it's gonna blow your effing mind, like, the potential nerve benefits from that. So, yeah, I mean, theoretically, if somebody had a nerve injury and they took supplements that had ingredients that had proven science that shows that it helps with nerve recovery, I would expect that. But I'm not going to go on record and say, buy my supplement because it's going to fix your mild penile nerve injury. Realistically speaking, with enough time, you're going to recover that way. But theoretically speaking, would a supplement like that help speed up your recovery? For sure. Um, Caleb's pumping routine. Hey, can you answer my question? Thank you for the super chat, bro. Uh, so my guy, Cruisin, he says, Hink, I'm currently down 30 pounds. Wow. I mean, you guys are freaking blowing my mind right now. So he says, I'm down 30 pounds and got an inch of length. So, like, guys, like, do you hear this? Like, I mean, like, I'm not trying to be a prick. I just come by it honestly. But it's like, if you guys were to lose weight, you wanna get bigger, but, like, you're overweight, like, why don't you focus on something that's going to make you bigger and make you overall more healthy and more confident, by losing weight? And guys, like, I'm not saying this as somebody that's, like, I've always been relatively thin, but I lost 30 pounds myself. Like, I had tits, and, like, I did not like the way my body looked, and then I lose weight, and I'm like, "Wow, my D looks so much bigger, I feel so much better," and so, no, I've never been was I technically obese? I don't know. My body fat percentage was probably about 30%, guys. Like, so I just know that I'm not trying to be like, I'm holier than thou when I say that. It's just we have guys like Cruisin that say, "I'm down 30 pounds and I got an inch of length of gains in 6 months." Let's see, and he also says, "From extending and soft clamping, I went from 5.5 to 6.5. Thanks for all you do." Bro, thank you for sending this message. I also would wanna know, um, 5.5 to 6.5, is that bone pressed or non-bone pressed? And also, like, how much of the length gains do you think is just from losing that 30 pounds, guys? Because 'Cause I'm telling you, like, I think 30 pounds of weight loss if you're overweight, like, I think that that would be at least a half an inch invisible length, if not more. At least that, if not more. So, um anyways, so Scott says, "Are you gonna do more workout videos?" Yeah, I am. Right now, guys, I have, it's really funny because, I've made this, like, folder because I have my, like, YouTube scripts folder. In the YouTube scripts, there's probably about 50 videos that I'm actively working on, or I have at least partial scripts for, or at least, like, really solid ideas for. But then I was like, I kept thinking of these ideas and I'm like, I need to prioritize this. I need to prioritize this. So then I made a subfolder in there that's called priority. And so, but in my priority video now, I mean folder now, I already have about 20 videos that I'm like, I have to prioritize these videos. And so, um, like for example, a urologist just put out a video and it says basically don't fucking joke. Is basically what the video says. And that's basically the title. It's like, what is this channel called? Euro something. Anyways, he's a German urologist. And so like I just made the script to that. I was like, I have to make this video. The point is that I will be making more fitness content. I just got to get through these other ideas that I wanna get through first. Um Cruising once again, man. Big shout out to you, man. That's fantastic. Um, let's see. Ooh, 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 ooh. So we got my guy Wood, man. The super chats are coming in like hard and heavy, man. And I'm supposed to be done in like 10 minutes. But let's see. So we got that. Thank you, Cruising, once again, man. So my guy Woo, very generous super chat. He says, Hink, I don't know if you remember me, the super chats with the jock itch. I did research. What I had was candidiasis balantitis. Like jock itch, it started when I was stretching. Now I can't stretch until it's gone. Question to the community. What is the rest of the question, my friend? Um, Question to the community. Let's see. Woo, did he respond to it? So, guys, for those that don't know, candidiasis is just a type of fungus. Like it's literally yeast. Like a yeast infection is candidiasis, just like thrush in the mouth. If you guys know what thrush is, it's like a white coating in the mouth. It's just a specific type of fungus. Now, the question that I would have is, well, I guess you would probably have to be uncut. I just don't know of any cut guys, any circumcised guys, that would have candidiasis balantitis just because, like, typically, in order to get, like, an overgrowth of candidiasis, of thrush, you have to be in an immunocompromised state. Like, for example, like, when I cosplay as a doctor, I have patients that are on steroids, and the steroids actually cause them to have thrush in their mouth. Sometimes antibiotics, if you lose your natural bacteria flora, like the natural bacteria either in your mouth or in your vagina, for example, you can be prone to candidiasis. But like typically on the penis, you don't really see it. Now, I don't understand why you were still having it, and I would still think a topical antifungal would make a big difference with that. Now it's not the most usually like fluconazole is the one that they give for candidiasis or diflucan. But like even like a nystatin powder should get rid of that very quickly. And so I don't know why that is. Like, that should be a 7-day treatment, and it should be gone, like, max, pretty much. Like I said, unless you have something going else going on. Now, I'm not trying to freak you out, but, like, have you been tested for HIV? Because, like, something like an immunocompromised state, I have seen people with HIV that have had different, like, things like that. So, but anyways, man, so at least I was kinda close when I said jock itch because jock itch is a bacterial overgrowth. It's just like the athlete's foot not bacterial, fungal overgrowth. But, anyways, man, I hope that clears up soon and, respond to that super chat if I didn't answer your question. Nacho Wookie says, "Any update on the discoloration routine?" I'm about to start an iodine chemical peel maybe next week, and so once I am able to do that and test it and see how it goes and report on that, probably another month, I'll make the video. For whether or not I've corrected it or not, I'll make the video. I will say I have made major strides in correction, even from, like, 2 years ago. Man, it's like it's way better. It's not perfect. So, anyways, um Jason Fry, another super chat. Thank you, my guy. He says, "Thank you for the reply. I also quit nicotine solely for PE." Man, mad props to you guys. The video I made on nicotine and PE, I made 2 of them so far. I think they're really good, and I think that's so underestimated. "But Hink, nicotine is a nootropic. Don't you know that nicotine" like, okay, guys, like, if that's you and you wanna do nicotine, have at it. Use a vasoconstrictor that's been linked with things like stroke and heart disease, even aside from the tobacco smoke. Like, do you? If you want to microdose it, you want to nicotine patch it to because you're on that grind set. More power to you. I think is fucking stupid, and I think it's dangerous and puts you at risk of addiction. So mad props to you, man, for being able to quit nicotine. Um, and so that's a plus. Already been 2 months in, and would love to see more people on. So yeah, man. Props to you. Thanks for the super chat. Mad prop. Man, you guys are making me like so happy tonight. It's like I have several guys in a super chat. One guy lost 30 pounds, one guy lost 40 pounds. And now you're texting me that you quit nicotine as well, man. Like, in my humble opinion, clown in a mask. Why are you people listening to me right now? Um, but that's fantastic, man. And I think that that is fantastic for your overall health. Real fast also, like, I'm finally back in the mindset where I can actually start going hard in the gym again, and so I hope you guys are doing that as well, and if you're not going hard in the gym, I would advise you to start going hard in the gym and working out, and if you don't have gym access, go on walks or go like, get a bike and ride or do something to keep moving, especially moving into the wintertime and the holidays. Um so Andre Etienne, non-bone pressed, I was around thank you for the super chat. I was around 5.8, 5.9, but after losing the weight, last time I measured, it's now around 6.2 to 6.3. Bro, fantastic. So that's almost a half an inch, man. And most of it came from a dramatic increase in erection quality with only limited pumping, man. Telling you guys, like, weight loss is the most underrated thing. Like, this is coming from a guy who literally sells courses to help naturally make your D bigger. I'm trying to tell you that if you were to lose weight, you probably would not need enlargement at all. Like, you just probably wouldn't even want it. Some of you might still, um, but it's literally counterproductive to my like meager bottom line to try to convince you not to do PE and to do weightlifting or weight loss rather as well. So thank you, man. Um, man. So Muhammad says, Hink, you changed my life. Not only your advice and science based backed methods, but your whole essence in being. You're kind, compassionate, and you are literally what us men today need, a man for the people. Bro, that's literally probably one of the nicest things anybody has ever said to me. And I'm definitely pinning that. I really appreciate that, man. You didn't have to be on here. You certainly didn't have to send that message, but you did, and that means a lot to me. And thanks, man. I mean, I really try to be genuine. I really want to like cliche as hell, but like I really want to help people, and I want to be a positive force for guys. And for the guys that want to get bigger, I want to help them get bigger. But for most guys, I want to help you guys know that hey, that adult star you think is 14 inches, nope, he's more like 8.5 inches, and that's a lot of angle and tricks. And so you guys feel better about yourself. So, but also, I do think uh, things like fundraising, charity are important, and that's why I encourage you all to do it. On Saturday, we started our fundraiser. So far, we've raised $10,000, and that's going directly to local cancer care in my area. And so, specifically, like patient transportation, as well as like other things like essentials, like people that need like they're coming from out of town and they need to stay in a hotel while they're getting treatment and whatnot. So, anyways, I encourage you guys to do those things and be part of. I'm gonna stop being preachy now, but just like my goal is that when people think about me, they're like, "Man, that he was a blessing." Like, that would be I hope that's not cocky to say, but that's what I wanna be out of life. I wanna be kind, and I wanna be, like, as much as I can to blessing to other people. So, anyways, I would encourage you all to do that however you can. So, thank you very much, Mohammed. Extremely kind, my friend. Um my guy Ortho OnlyFans, he says, "Mom, Stouffer's lasagna, vigor, creatine, caffeine." Man, like a lot of guys don't realize that caffeine. Thank you, Ortho OnlyFans. That caffeine is a actually good for erection quality, for the most part. But Hank, it's a vasoconstrictor. Like if you haven't seen my video on caffeine, guys, check it out. Um, but um, but yeah, man, vigor and creatine. I'm paranoid so, like, a while ago, I was taking creatine again, and I was getting stronger, but I started losing my hair. Like, it was noticeable. And my bald spot right back here, like, really started to shine through. So now I'm paranoid to take creatine again. And the data is very poor to suggest any kind of link between creatine and hair loss. But I swear, it could have been something else. Maybe it was just stress. I don't know. But anyways, I don't touch creatine anymore. So, but yeah, I appreciate the love with vigor, also, man. Uh, Mika Bastakar, elasticity recommended supplements you recommend. Um, Safeguard, I think, obviously I'm gonna plug my own supplement, man, but Safeguard, it has ingredients that have proven anti-lysyl oxidase activity, okay? Now it's not anywhere near the same as like BAPN or one of those ingredients that they use on the clinical trials. But what I do think is that it can help with overall like tunica elasticity, help more importantly, like prevent fibrosis and scarring. And there is questionable evidence that it could help tamper down that collagen response. That's why I designed it. So, once again, if you want to support me, it's our Safeguard product here, leviathansubs.com. Or if you don't want to support me, just look at the ingredients on the back. Chat GPT, how does this help with collagen elastic or tissue elasticity and soft tissue protection? And see what it says and see if I'm full of shit or if I actually know what I'm talking about. I know the answer to that, by the way. Um, Question for the community. If you have inflammation on your area, what did you do to get rid of it? I've stopped stretching for a long while and lost gains because of it. So, bro, it depends on like what the inflammation is from. Once again, so thank you very much for the super chat. But like I said, I mean, like you shouldn't just be getting like a chronic Candida infection of your penis, and like inflammation. Like if every time you do PE, you are getting like redness or itching or peeling, like you might want to try some better skincare afterwards. And so, like a nice, like I don't know, if you go into like Walmart, if you have those where you are, um, uh, and you actually get like Jergens Ultra Healing Aveeno damaged skin and put that on your D after PE, like you're gonna help with skin recovery. It's not gonna help with gains, but it's gonna help with that. My guy, Dr. RX72 says, I lost 40 pounds. I didn't forget about that. That dude, and I've seen his pictures, not of his meat, unfortunately, but I've seen pictures of like his dramatic weight loss. And it's insane. Lean and mean, man. Dude looks great. Good looking dude. Sorry. So I just jumped around. I just saw him in the chat. Uh, so the other thing that you can do, like if it truly is inflammation, and I don't recommend this, but you could use a topical corticosteroid like hydrocortisone. But like if you are using a corticosteroid and you have a fungal infection, that's going to make the fungal infection worse. So I would not recommend that. So yeah, just be aware of that. Um, but yeah, I mean, I would stop doing any kind of PE until the inflammation resolved. I would actually see a doctor. It sounds like you self-diagnosed candidiasis ballontitis. I don't know if I agree with that diagnosis, but if it is that, you need to see a doctor so you can get the appropriate antifungals, um, and you need to figure out what's causing such severe inflammation. Because I mean, I'm not trying to isolate you or make you feel bad, man, but that is not normal. So, yeah, let me make sure that man, we got 112 people in here and 86 likes, man. I would love to see that hit 100, but, you guys have always been already been very generous, so I'm not gonna beg or anything. This is an interesting question. Jacob says, "Hank, being a Christian, do you think that doing PE is a sin? This has been on my mind for a while." I mean, that's something that you're gonna have to come to peace with yourself. I absolutely do not view it as a sin. Now, if you have to do uh, if you have to like fap afterwards or something or engage in the adult industry and like that's why you view it as a sin, then that's okay. But like just the act of self-improvement to me, I mean, because that's what this is. I don't think that's a sin. Um, But, I'm of the belief now, once again, guys, like, I like to say I'm a Christian, but I'm not like and I know some Bible verses, I've read the New and Old Testament, uh, but, like, I don't know specifically what the Bible allegedly, like, says about masturbation, but personally, I don't view that as a sin. Like, if I do that, I'm not like, "Oh, please God forgive me for I have sinned." Now, I do pray for forgiveness in general for my sins, but I'm not like, "That is a sin. I am sinning actively right now." And maybe that's just because 'cause I'm a bad person. But, I don't know, man. Like, I don't know that that's I don't know that that's a healthy way to look at it, in my humble opinion, but, like, who do certainly, guys, do not come for me for any kind of religious advice. Good lord. It's bad enough that you guys come for me advice for how to tug on your peepees. But that's just my take. I don't know. Chat, what do we think, chat? I don't know. I mean, that's an interesting, start a poll. Let's see. Is PE a sin? That's a, that's interesting. I mean, I've never even thought about that. So, uh, but yeah, if you guys want to hit the chat, and we'll see what the chat says about that, man. Let's see. Let's see. I'm listening. Wait. Did I? Hold on. So, Talk 72 with the super chat. Thank you, Ian. He says, Ink, I lost 40 pounds and keeping it off by intermittent fasting, keto focused nutrition, and working out. I'm listening and working out. Peace and love. Man, I appreciate you, bro. Thank you for being in here. Thank you for showing love with the super chat. Um, and I mean, and I'm proud of you, man. Being able to get that weight off and then also keep it off is huge. And you have clearly found something that works for you. If you guys haven't seen my video on intermittent fasting, you guys know that like that's what works for me, guys. Like it's hard to overeat calories when you're not eating. So, but figure out what works for you. But thank you very much, Doc 72, for that super chat, man. Uh Sorry, I'm seeing my guy Ortho OnlyFans, but he says, "Mom, Stouffer's lasagna." Like, because I'm lifting more, my appetite is increasing because I think I'm stimulating more, like, protein synthesis, but these freaking Olive Garden commercials with the never-ending pasta are driving me crazy. I want lasagna and I want pasta from Olive Garden so bad, and it's not even that good. Like, it's very good, don't get me wrong, but it's not like, "Oh my gosh. Now this is premier eating. This is good Italian." You guys like my Italian accent, but, man, anyways, that seeing the Stouffer's lasagna just made me I'm going to Olive Garden this weekend. Who's with me? Oh, man. Guys, 2 more likes and we'll be at 100. So, anyway, so that's interesting. So with this poll right now, there's 11% of people that think that PE is a sin. That is very interesting. There's only been 47 votes. So I don't know how many people that actually is. So well, let's see, 10% of 48. So it's like 4 votes, but still that's wild to me. I mean, but hey, whatever, I don't know why you're here doing P like to me that would if I thought like I was doing something wrong, like I wouldn't do it. Like if I thought that I was really doing like something wrong, I wouldn't do it. And that would really F with me if every time I was trying to do it, I thought I was doing something wrong. So that's wild. But hey, that's why there's differences in opinion. Uh, we got Doc 72. My guy Muhammad, it says, "You literally changed my life, Dr. Hink." Thanks, bro. I really appreciate that, Muhammad. Like, once again, thank you so much, bro. Like that is so kind. That is really kind. And that's what this is about. And so uh man, especially in trying times, man, that's like stuff like that is what really does get me through. So thank you. Let's see. Let's see, because we got some other super chat. So, guy who lost 30 pounds. It was bone pressed. I'd say a half an inch was from extending, and a half an inch was from weight loss. Spot on, man. After extending and soft clamping, bone pressed to 6.75. That's awesome, bro. That's fantastic. Thank you for the follow up super chat. That's extremely generous to follow it up with that. But man, that is that is awesome. Um, So Caleb says, Muhammad, I've been doing boxing for 2 years. Self defense is truly a game changer. Speaking of self defense, I actually have my concealed carry. And so I don't carry. I think I talked about that before, just because I don't want the temptation of like some dude pisses me off and like I pull out my strap. And the next thing you know, yeah, I just called it a strap. The next thing you know, like I'm on what do they call brandishing charges. And so I just wanted to have it just because, like, sometimes I travel with it. Sometimes, like, when I'm going out to the country, I will have it on me, and if my shirt falls over it, I don't wanna, like, potentially be in trouble just because, like, my shirt came untucked. And so, anyways, that's self-defense here in America is get you a gun. There's a really old movie called Friday, and thank you guys for giving me 100 likes. But in one of the parts, like the old man John Witherspoon, one of my favorite comedians all time, but he's like, basically, you need to put down the guns. You need to learn to fight with these. It's like you win some, you lose some, but you live, and it's a very powerful thing. And so many guys are fucking pussies and just resort to guns and think that they're tough because they're brandishing a firearm. So anyway, shouts out to Caleb for boxing. I did it for a while. Boxing is the hardest form of cardio I've ever done personally. So thank you again, Cruisin. Sacre bleu. He says, ooh, I'm really thinking about getting on TRT and a GLP-1. I'm 29, I'm 6'5", 370, did lose some weight, but I feel like it would help me much more in general. Um, I am pro GLP-1s, guys. Like, I don't know what to tell you, and, certainly I think some people are gonna be like, "Oh, that's the easy way out, blah, blah, blah." Like, I don't care. Like, I think it's so much there's actually evidence, guys, like, there's clear evidence that has recently been published that actually the GLP-1s, Ozempic, are actually decreasing cancer rates in America because of the, like, obesity-related factor. Not just that, there's evidence of a 25 effing percent overall mortality improvement by these GLP-1s because they're decreasing rates of, like, heart disease, hypertension, diabetes, and so, like, I mean, like, talk to your doctor, don't get it, like, illegally through these, like, random research peptides or whatever, like, I don't know, whatever, talk to your doctor, do you, as long as it's not illegal, but, like, I'm not gonna dissuade you not to do a GLP-1. I think that there is so much merit for that, and so many people struggle with, like, "I've tried dieting and it hasn't worked for me," and so when you go on, like, something like Ozempic and then you, like, finally see the scale moving and then you lose, shit, 10 pounds, and you're like, "Oh my gosh, I feel so much better, I'm moving so much better, this is amazing." It really starts this, like, positive cycle. Now the problem is if you come off of it, because studies have shown, last I checked, that, like, 80% of the people or, like, people regain back about 80% of the weight that they had lost. And so you need to make sure that you're not just because like Ozempic is like, okay, normally I would eat an entire large pizza, but on Ozempic, I'm full after one piece and I'm stuffed after one and a half pieces. And so, like, if you don't change your diet habits, you don't change your exercise habits, you're going to get back on it. What I don't like is TRT. Okay. Talk to your doctor. You have low test, whatever, do you? Okay. But I think it's really a cop out that so many younger guys are doing TRT and not trying to do the right things to like maximize their natural testosterone, like sleep, diet, hell, even our vitality supplement here, which has things like boron and ashwagandha and many other ingredients that have proven to actually like increase test levels. Um, the other thing is like if you're on it long enough, there's a chance you might need to be on it for life. But if it's going to help you lose weight and get to a healthier weight, because you're 6'5", 370, I'm 6'5", 200 pounds. And so there's like, I mean, that's like that's a lot of weight that you need to lose, in my opinion, to be healthy. Okay. And I hope this isn't a hot take, but guys, you can't be healthy at any size. Like, I'm just calling it like it is. You can love yourself at any size, and you cannot like hate the way you look at any size, but you can't be healthy at every size. And so you do what you have to do. Talk to your doctor, talk to your nutritionist if that's what they put you on. But I would just be hesitant to recommend TRT. Sacre. Um, but like if you feel like that's what you need and that's what's going to help you, I'd rather see you at a healthier body weight on TRT, and especially if it's like actual test replacement and not like a mini cycle or even a real cycle and you're pushing your test at like 1,000 nanograms per milliliter. I would rather see you do like I mean TRT and GLP-1 and lose 100 pounds than to not be on it and to still be over 300 pounds. So in risque. This is my Sith mask, isn't it? Um, let's see. I'm tired, guys. And let's see. I think was that the ooh, 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 ooh. So I got Socre. We got several other super chats that I'm missing. So guys, thoughts on retatrutide Ozempic at 18% body fat? I think it would speed up the process. 23-year-old male, workout 4 days a week. Like if you're a 23-year-old male and you're at 18% body fat, like you're already at a healthy weight, in my opinion. Okay. If you're truly at 18%. It says my connection is unstable, guys. If I okay, I don't know what's going on with YouTube, but it says at 18% body fat. Let me see if this is gonna hopefully that doesn't interrupt my my live stream, guys. Sorry if it did. But so when it comes to retatrutide Ozempic, retatrutide is still very much a test like in testing, okay? It is not approved for human consumption. That being said, I think it has some very promising data. I've seen some ridiculous transformations on Reddit, and it works on multiple different pathways rather than just like a GLP-1 like Ozempic. And so Ozempic is kind of like a first gen thing. I think there's I always say tears of peptide, but like that's super wrong. And my guy Ben from Mailhanger called me out and he was like, "You just kept saying that." And I was like, "What the hell is he talking about?" And he's like, "Oh, he's talking about tirzepatide." I think that's how you say it. And I was like, "Yeah." So anyways, but there's other one that work on multiple different pathways and retatrutide, if I'm not mistaken, it works on like 3, but it also works to potentially, like, increase fat metabolism. I It's been a while since I looked at that. Um, I just think that that's a gateway into performance enhancing drugs, and I am a very much like a pro natural kind of guy. It doesn't mean I think that you got to figure out what's right for you. Now, if you were at 28% body fat, I'd be more inclined to say that, but I would hope that at 23 years old and only 18% body fat, you could really like lock in and have the discipline it takes to eat less and move a little bit more. So I would be against that, if you were to ask my personal opinion, but talk to your doctor and figure out what's right for you. It's just my opinion. Thank you for the super chat, man. Andre said, I just wanted to thank you for the generous super chat once again, man. He says, I just want to say I'm a big fan of you exploring the idea of making more complete health content. What got me going on my weight loss journey was the amount of good and digestible info I could test. I appreciate that, man. And I'm gonna bring some of that into here. It's just that there's so much of fitness, like, influencer content on the internet, and even these, like, science-based guys that I don't think I really add against, I don't think it would add too much. Okay, so as far as the sin question, 93% of people said that they do not believe PE is a sin, and so that's more in line with me. But Greg says people that think people is a sin are probably the people that think tattoos are a sin. Uh, yeah, I don't, uh, yeah, I mean, maybe. Um, but isn't there some kind of like weird biblical reference about like not using, I don't know, not having tattoos or something? I don't know. But I'm not gonna say be like, oh, if you have tattoos, you're a sinner and you need to burn for eternity. Like, that's not my approach to Christianity, at least. Doc, I use extender with vacuum cup 60 to 90 minutes every night. Um, Is that good? Yeah. Yeah, I think that's great. How long should you extend? I think that that is, an ideal amount of time, somewhere between 60 to 120 minutes. Also, is it stretching tunica or ligament? It is stretching your penile tissue, including your tunica for the most part, especially if you have an extender that has like a base part on it. And then, so it's like, a part on here that goes on the tip of your D and then a part that goes against your base. Most of that stretch is going to be in your actual penile tissue because the base is actually pushing against that suspensory ligament. So, so Andre says PE is not a sin. The Bible is clear that we are to treat our temples with the utmost respect and care. Improving our bodies is not the same as defiling it, and our intentions also matter as well. Yeah, I think that that's a very good point. Like, if your goal in PE is so you can send D pics to a bunch of chicks and go out there and slang your meat in anything that walks, like, I mean, that to me is more like pushing a sin. But just if you're trying to do it just to better yourself, or you're thinking about like your potential spouse and being more confident with her than or your actual spouse, then yeah. Caleb says he can make a workout routine or I'm whooping ass. It's coming, bro. I got to get in shape first. I'm out of shape. Um, Yeah. So, so Trunk says, "What has been your lowest body fat percentage, and how do you feel? And how did you feel? Realistically, I probably got down to about 12%. like, I would say in the past 5 years, I probably haven't been lower than 12%. And when I've been that lean, like, I've been pretty shredded, man. Like, people, I mean, just grossly, like, I don't even like talking about it. People have no fucking concept of, like, what actual body fat percentages actually are. And so, like, let's see here. So probably here, okay. Oh, man, I don't even know if I can get that to show. Uh, 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 there we go. So probably there, I was probably like, I don't know, 14% body fat, maybe 15. Like you could see my abs, but like clearly, like, I don't know. I can't find that cut, but like you could see all my abs, my definition, all of my quad muscles. But when I was that lean, I did notice my test started to dip a little bit, and I also lost a lot of muscle mass, because I was doing so much fasting. So I was, like, super thin, and I didn't really like being that thin, but I felt good. I felt good for the most parts until my test started to drop a little bit. So, um, I think let's see, we got one more super chat. Dean, my guy, Jack dude, you guys need fitness advice, hit up Dean. Look at that thumbnail, damn. Um, all Diddy, all Diddy. You need some baby oil on the thumbnail. Is it normal to see more erect gains than flaccid? I have a grower and it's cool, but I want but and cool and all, but I want flaccid gains. I do 40 minutes manuals and PMP 40 kPa. I think that's a solid routine, man. Uh I don't know. I mean, like on my Hink trial, the participants gained a half an inch in length in 6 months erect, but also a half an inch in length in flaccid length. And so, um, I, and so for some people, like you might just have super high levels of elastin in your D. Elastin is what basically makes it stretch, but it makes it like come back into it. And that might just be the case, man. But I would say that's something that you're just going to have to be consistent with. I'm also happy that you're getting erect gains. Like flaccid gains, it's so much easier to like kind of cheat the system, if you will. So like if you want to look like you have a flaccid, big flaccid, like just pump like before you go out, before you go to the beach. And you're gonna, especially if you've been pumping for a while, you're gonna have a solid like 60 to 90 minutes, maybe even more of like solid hang in your D. Especially combining something with a good blood flow supplement like Vigor. Um, yeah, and guys, if you want, personalized, well, it's not really personalized, but if you want to learn like all my techniques that I recommend for how to get bigger, including flaccid size, consider my course. Link is in the description. It's the same course that was on the Hink trial that, participants on average half an inch in length, quarter inch of girth. So appreciate the super chat, Dean, but I think you need to just study the course, man. And over time, the elastin is going to stretch out and you're going to cement more flaccid gains. Trying too hard says, "Can I do 2 rounds within a few hours?" Yeah, I think, and I'm making a follow-up. Another one of my highest priorities is making another collagen video because I found, of course, a lot more data backing the point that I was trying to make that I think I didn't make very clearly. But the point is that, yes, definitely. I think ideally, if you're gonna do multiple PE routines, like, to get it done within 3 hours, 4 at the max, but once you start moving past that, you're getting closer and closer to re-stimulating more collagen production. Um, is there a science approach to clamping before pumping or vice versa? There's no scientific data on clamping, um, period. There is on pumping, and so I don't like to clamp because I think it's higher risk, yeah. Oh my god, Mikal, please don't do DHT cream at 23 years old. Please, for the love of Christ, don't do DHT cream at 23 years old. Um, but thank you for the super chat, B-Face, but, it's just like, anybody who knows me knows I'm, like, anti-clamping. When I got hard flaccid, it was because I was clamping, and so, I also have coached several, clients that have hurt themselves by doing, by clamping, so, yeah, I don't like that, uh so, yeah, I would try pumping, and if you try pumping and you either don't like it or your gains have stalled, then maybe try something else. So, Genesis 38, 9 and 10 Old Testament, not New Covenant. Uh, appreciate that, Ortho OnlyFans. See, I certainly don't know the Bible well enough to know what that's talking about. I mean, I know the book of Genesis, of course, but yeah, I don't know what that scripture is, man. Um, yeah. So, man, all right, guys, I'm tired, and this is actually 25 minutes longer than I was expecting it to be. So I think I got all these super chats. I need to just make sure I like the super chat as I answer it. And that way I scroll through and see my little hink heart on it, and we're good. And I know that I answered all of them. All right, guys, I think I got all these. Going live tomorrow with an interesting video. I'd like for you to watch it if you can, obviously, but um, it's about a like it's a little bit of a different format, but it's like there's a topic that I've just felt that we needed to discuss and like the elephant in the room. And so I'm gonna leave it at that and try to be a little clickbaity with it. But yeah, let me know what you guys think. But yeah, I love you guys. I appreciate you guys. And so let's see. I've seen my guy Ethan. He sent this. I think he sent this last chat too. He says, "I injured myself 1 month ago by doing manuals. I forced too hard and felt a tear on the left side of my D. I get better now, but I still feel the pain when I try to pleasure myself. So you need to stop any kind of intercourse, any kind of self pleasure. I would say for at least, God, at least 10 days, if not 14 days, and see if you can give that further time to heal. If you are doing, the more you are doing, like irritating that area, even by like fapping, the worse it's going to get. So please take time off from that. Please take time off from that. Yeah, man. So, but yeah, I love you guys. I appreciate you guys. I'll catch you on the next one. Definitely going to be going live probably again on Friday night, but another video tomorrow. So, anyways, I'll catch you then. Peace and love.